Welcome everyone into the space. I'm Nicole Brookshire, National Consulting Director with CSH. We're joined here today with other CSH staff members as well as our great partners coming from California Department of Housing and Community Development. So we'll get everything started within the next couple of minutes. We just want to welcome everybody into the space. If you'd like to drop in a chat with your name, agency, and things you'd like to learn today about the Supportive Housing Services Plan Guidebook and Template. We'll definitely get kickstarted and roll out to be helpful to help share the plan, but we'd love to learn a little bit about you as we get situated to get things kicked off. Just taking a quick peek at the chat. We will be able to share a copy of the presentation as well as the actual guidebook and template. They won't be available prior to today's presentation, but shortly following commencing the wrap up of the presentation, we will be sure to send those out to everyone who participated on the call. And just taking a quick peek of those that have placed their name and place of business in the chat, welcome. It looks like we have a good representation across the state of California. So we're excited to hear a little bit more from each of you, as well as share a little bit more about the process as it pertains to the development of the guidebook and template. We're almost at that 50% mark. I think when we get a little bit closer to being at least 50, if not 60% of those who registered to attend today, we'll definitely get started. So if you could give us just a little bit more grace of maybe another minute or two, feel free to grab yourself a nice cold beverage, a quick snack. We will definitely get started in the next minute or two. It also looks like we have one individual who had just used their phone to call in. So if there is a special request for you to have a question, we would like to maybe help hold some of those questions in the chat box. If you have the ability, the phone in caller, to maybe raise your hand, I might be able to help navigate your questions, and or we will be sure to again follow up and help clarify any questions that you may have. And then just looking at my presenters today, are we good to go? Can I get a thumbs up? Good to go? Okay, okay. Without further ado, again, to those that may have joined, I'd like to help introduce myself and then help roll it over to the partners on the call today. My name is Nicole Brookshire, National Consulting Director with Corporation Supportive Housing. I am joined with my great team from the consulting department of Alyssa Languth and Maya Saxena, as well as our great partners coming from the Community Department of Housing and Community Development. So we welcome you all into the space today. And if we could go on to the next slide to get us kicked off. Would like to again highlight a little bit of why we're coming in this space today, and then a little bit of the housekeeping. Again, any questions, feel free to use your chat box to identify your name, say hello to all the partners on the call, your place of business, and then again, if you like to again start circulating some questions that you may have as you learn a little bit more about the guidebook and plan, feel free to jot those in the chat, and we'll keep a close eye and help look to answer those questions as we can throughout the call, or offer some supports to those clarifying questions in conjunction with the state of California. This and why we're here today. We are working closely with the California Department of Housing and Community Development to really, again, establish a best practice guidance for supportive housing providers and developers. And that was in the creation of our organizational supportive services plan. We are hope that this service plan will help inform housing providers in building a critical foundation that really allows for the implementation of quality supportive services, those that are voluntary, flexible, person-centered, and trauma-informed. And so this webinar today will offer an overview on the guidebook and the template. All attendees will have a better understanding on how to leverage the guidebook and template and how it can be utilized to implement quality services into your organization and to help lift up the opportunities for quality with services for those you serve within those units. It will include addressing suggestions for where you look at your staffing ratios, analyzing community and population specific service needs, and also establishing and evaluating service outcomes. So again, we will leave room for you to ask questions, but if you come across any at the start of the presentation or throughout, please feel free to jot them down in the chat box. And I will turn it over to the CSH team, or excuse me, California team. Nina, take it from here.
Hi, thank you, Nicole. Hi, everyone. And again, my name is Nana Garcia. I'm the Homelessness Section Chief here at the California Department of Housing and Community Development. And on behalf of HCD, welcome. We are so glad you can join this presentation. As Nicole mentioned, HCD has partnered with CSH on the development of the Supportive Housing Services Plan, Guidebook and Template we'll be sharing today. This tool was designed to support the critical work being done across our state to house and serve people who are or have experienced homelessness. We hope these materials are helpful resources, whether you are in the beginning stages of designing your service plan or are currently implementing services. After today's presentation, HCD will continue to answer questions regarding this content and will soon make all materials discussed today available on our website. Our contact information will also be shared at the end of the presentation. Thank you again for joining us and for the work you do in your community to help further our state's goal of preventing and ending homelessness in California. And I will pass it over to the CSH team.
Fantastic. Thank you, Nana. Thank you, Nikki. We will do some quick introductions, Alyssa and myself, and then we will dive right into the content. My name is Maya Saxena. I use she, her pronouns. I'm on the national consulting team here at CSH, and I am based in sunny Atlanta, Georgia.
Hi, everyone. My name is Alyssa Langeth. I use she, her pronouns. I'm also on the national consulting team, and I am based in the not so sunny northeastern part of Connecticut. Thank you.
Fantastic. And Nikki, to you for the agenda.
Yes, real quick overview of what we'll be tapping into today. Our agenda is really segmented into 6 sections. We'll highlight a little bit about our process. What do we use? Who do we engage with to compile this great information on supportive services and the detailed guide? We'll give you and share an overview on the intentionality of the template, as well as go a little bit deeper on the guidebook itself. We will make sure to highlight a little bit about the attachments or those addendix of additional helpful resources that we have. We want to leave room and space for, again, a practical application of how this pertains to your work, as well as close out the webinar today with opening up the space for questions and answers that you may have. And I'll turn it back over to the team.
Perfect, thank you. So we'll start with a little bit of how we got here, what our process was when thinking about and then creating these materials. We first spent many, many months outlining the template and the guidebook, making sure that we covered all necessary topics and created some drafts, a draft template and a draft guidebook. From there, we partnered with 3 individuals with lived expertise of living in supportive housing and sat down and did a really thorough review of all of our draft materials in partnership with them. Those were 3 90-minute interviews, and we had asked those folks to review the materials prior, and then we had a 90-minute deep dive into what was missing, what's working well, what's not working well. And then finally, here we are, we're releasing the guidebook and the template. We're really excited about this. It's been a huge collaboration between HCD and CSH, so we're excited to be here today. A little bit more about our process when engaging and partnering with folks with lived expertise. We did have a series of questions that you'll see here on the screen that we did pose to our folks with lived expertise through a 90-minute interview. There were 6 total questions, really centered around the content of the guidebook and the template. So what was missing, what wasn't missing, and how the template and the guidebook should be used. Those conversations were really fruitful, really thoughtful, and we were able to implement a lot of critical suggestions from folks with lived expertise into both the template and the guidebook. Some of the themes or comments and feedback that came out of those 3 90-minute interviews, you'll see some quote bubbles up here on the screen, but strong and insightful feedback around the role of peer support workers. So at the end of the day, what role do peer support workers serve in supportive housing? How critical are they to providing quality services to tenants living in supportive housing? What does accountability look like? So when we're creating a service, a supportive housing service plan, where's the accountability to following that plan? How often should supporting housing staff and service providers be revisiting that plan? How should that plan be communicated and distributed to tenants living in that supportive housing program? So we had thorough conversations around what accountability looks like and doesn't look like, as well as what quality services look like. A big takeaway that we heard throughout, I believe, all 3 interviews was the need for centralized services and for a majority of services to be available on site. As we know, transportation can be a barrier getting from place to place, maybe not having great access to public transportation. And so a really strong theme that we heard across these interviews was, as much as possible within supportive housing programs and buildings, we want to have services centralized, available, and on site. And Alyssa, I'll pass it to you.
Thanks, Maya. So that was a great overview of our process. Now I'm going to talk a little bit about the topics and give an overview of the template and guidebook. So the major components of the supportive housing service plan are the 16 topics that are listed on your screen here. Each of these topics in the guidebook, we have listed out a couple of paragraphs on the best practices and an overview of what each is. The guidebook is intended to provide best practices and definitions and information on each section. I am going to take some time right now to talk about each of these sections that you can find in the guidebook. And each of these sections that are included in the guidebook have a corresponding guiding questions in the template document. So for example, the project philosophy, this section for the guidebook is really the supportive housing's program mission, their vision, their values, the philosophy, and all of this should be rooted in housing first. Housing first is a philosophy that homelessness can be most efficiently ended by providing someone with access to safe, decent, and affordable housing. The service provider's supportive housing philosophy can really describe how services are being provided and should include principles of housing first, trauma-informed care, harm reduction, strength-based and person-centered approaches. For this one, I want to pause a little bit and just touch briefly on what housing first is really quickly, because it's such an essential part of supportive housing. So the housing first philosophy focuses on simplifying the process to access housing through streamlining the application process and removing unnecessary documentations or site visit. It also ensures that supportive housing tenants are not subject to conditions of tenancy that are exceedingly a normal leaseholder would have. And that includes they're not required to participate in treatment or services. There's fidelity behind the housing first behind Housing First, and research has demonstrated that this approach is effective to promoting housing stability, especially among the people that we are most interested in housing. So this is just a brief overview we provide in the guidebook about what the program philosophy is, and then we have some resources linked in there. And then what the template does is it has guiding questions to alert the user on what they should be including in the plan. So for the program philosophy section, we then, in the template, we then ask the user to include what their supportive housing mission is, what their supportive housing vision and values are. If all the project partners include or understand Housing First, and what is some evidence that the property manager understands Housing First, or maintenance staff, or if there is 24/7 security, if they all understand Housing First. I am going to quickly define, go very quickly through all 16 topics, because that is really the meat of the guidebook, and the components that, after talking to people with lived expertise, that we felt were most important to include in the service plan. So the next one is roles and responsibilities. It's really important to understand the discrete but coordinated roles and responsibilities of each supportive housing partner. So we have those outlined in the guidebook as the owner of the building, the service provider, the property manager, maintenance staff, front desk staff. And then we ask in the template for you to identify who those individuals or companies are. The third section in the guidebook is partnerships. Supportive housing is, quality supportive housing depends on clear and defined partnerships. So it's essential to outline those partnerships, and best practice is
Okay, I'm seeing, I believe Alyssa might have dropped for just a second. Thank you all in the chat for, thought it was just me for a moment, but we will keep it moving. Partnerships, I think Alyssa was probably speaking to the fact that clear, defined partnerships with established MOUs or memorandums of understanding really help bolster quality supportive housing operations. So we do speak to that in both the template and the guidebook. And Alyssa, if you are back on, please feel free to jump in, but otherwise I will just keep us moving through these couple of things. The next topic we have in both the template and the guidebook is coordination between property management and service provider. This is really the meat and potatoes of operating quality supportive housing. The relationships and the coordination, the way that property management and service providers interact, communicate important information, or just daily shift reports really makes supportive housing operations flow much smoother. So we do go into the guidebook and the template best practices around confidentiality, what can be shared, what cannot be shared, what should be shared, what should not be shared, as well as best practices for establishing meeting cadences and lines of communication between both property management and service providers. The next section that we have in the guidebook and the template is a program overview. So this is really kind of the high-level screenshot of what is this program's total number of units, how many of those are affordable housing, supportive housing, market rate housing, who is the intended population or populations to be served within that supportive housing program, and a few more of those types of logistics that give you kind of that bird's eye view of that supportive housing program. The next topic we have is program design, and this section is really focused on trauma-informed design. We've referenced a few really quality resources on best practices for trauma-informed design, including things like green spaces, access to wayfinding, clear signage, and ways to make the actual appearance and physicality of a building, a unit, trauma-informed, safe, and approachable. The next topic we have is analysis of need for services. This really looks at what data sources, federal, local, statewide, etc., have been reviewed and accounted for when trying to identify what population or populations will be served in the supportive housing program, as well as what is the need in your community for this population to be served, to be housed, and to be provided with quality services. The next topic we have is staffing. There are, based on different service models and different populations that will be served through this supportive housing program, best practice guidelines for staffing ratios of case managers or service providers to tenants. That can range from maybe 10 tenants to 1 case manager. And then for varying models, it can go all the way up to about 20 or 25 tenants per case manager. The next section we have is services provided. We do go into, in the guidebook, we go into depth about, I believe, 5 different service provision models: critical time intervention, intensive case management, tenancy support services, ACT, and we analyze who is best served by each of those service models. We do go into depth about what is different between those service models, what is the same between those service models, and best practices for deploying those service models.
Maya, I can jump back in now. Sorry about that. My computer shut off. I apologize to everyone. So the services provided. A supportive housing program can clearly deploy multiple service models to be utilized with different tenants. Services within supportive housing should be rooted in cultural humility to really meet the needs of the individual tenants. Cultural humility requires an understanding of the historical context and various cultures and populations, as well as an ability to actively engage in self-reflection when interacting with individuals and tenants from different cultural backgrounds. The next one is tenant involvement. I'm not going to spend too much time on this one because Maya is going to go into great detail about how tenant involvement can be incorporated into your supportive housing service plans. But just 2 sentences: tenants living in supportive housing are really the experts of understanding what quality supportive housing looks like. And tenants, we believe that tenants should be engaged through each phase of developing, operating, and improving the supportive housing. And Maya will go into some of the best practices around that. The 11th section is the tenant rights section. It is extremely important to protect tenant rights, and it's one of the main responsibilities of the service provider. This should describe how tenants' confidentiality will be maintained and how they will be informed of their legal rights. Many supportive housing providers require a release of information to be able to communicate with community providers, referral agencies, and various other providers. It is important for providers and the service provider to remember that tenants are not required to sign an ROI or authorization forms, and that the tenant can revoke this release at any time. Of course, we like to encourage tenants to sign ROIs, but it is ultimately their right. Commitment to training. It is important in your service plan to identify your commitment to training and what that training will look like for your staff, not just onboarding, but the ongoing training. Some common trainings we see in quality supportive housing programs are trainings on housing first, harm reduction, motivational interviewing, cultural humility. And then the next one is fair housing. This is an area where the service provider and the property manager work very closely together. And the majority of the fair housing responsibilities will fall on the property manager. But it's extremely important for there to be coordination between the two. And supportive service providers' main responsibility when it comes to fair housing is assisting tenants around seeking and advocating for reasonable accommodations. The next one I'm gonna talk about is outcomes. It's really important for quality supportive housing to understand the outcomes that you're looking to see for your program and for individual tenants. Identifying these outcomes early in the program planning phase is essential to the stability of the program. It is also really important to understand where these outcome metrics are being required. This can come from various partners, including external funders, the owners of the building. And outcome reporting metrics can often be found in the funding agreements and then also in any NOFA that you applied for funding. It is also commonly seen to include metrics, outcome metrics in memorandum of understandings between the owner, the developer, and the service provider. Property management companies and the service provider may also have their own metrics that they report on and review on an annual basis to ensure quality services are occurring at the program. The 15th section is eviction prevention. Eviction prevention strategies really guide all other actions and the processes and procedures relating to a potential eviction. It's really important that this strategy is broad but also general enough that it can be easily applied to supportive housing programs. The policies you create under your eviction prevention plan should be reviewed and revised on a regular schedule. And it really should include the tenant input when reviewing these policies and procedures. And then procedures can be changed anytime in response to program changes or quality improvement strategy. The final section that we have on in this guide is the program funding. It's really important to describe where your funding is coming from, how you will pay for all the services that Maya and I just described. So it's important to understand the costs of the services so you can adequately cover those costs. When we look at service program budgets, the majority of the costs we see come from personnel costs, but there are also operating costs and indirect costs that needs to be accounted for. And the personnel expenses can vary greatly depending on the service model and the necessary staffing ratio that you include in your service plan and what you are accomplishing on site. So those were the topics we include. There's 16 of them. The supportive housing service plan guidebook also includes some key terms that we'll show later on in the presentation. And then we have attachments in this guidebook. So in addition to the best practices and overview of these topics, we also have supporting tools that can help you help you create this service plan and help you create a quality supportive housing project. Next slide, please, Maya. Great. So the purpose of this guidebook is to provide permanent supportive housing programs that serve people who have experienced homelessness or are at risk of homelessness, to provide permanent, stable, supportive housing. It is really to help help developers, property managers, tenants, and service providers create a plan that dictates what will be occurring in the community that they are working in. Next slide, please. For the intended users, I think the obvious user here is the service provider, because they will be responsible for ensuring that the tasks in the supportive housing plan are accomplished and that they were working with tenants. But developers may really use the supportive housing service plan to better understand best practices in supportive housing. Developers may not be living supportive housing. They might be an affordable housing developer that's getting started in supportive housing. Once the project's placed in service, they might not have as much to do with the day-to-day, but it's still important to understand service delivery expectations of the service provider and how that relates to tenant outcomes. It's important for developers to also, if there are contracts or MOUs with the service provider, to be able to outline what they would like to see within their service plan, within the service plan in the building. So it's a lot of this guidebook can help with transparency and communication between service providers and developers. We really encourage the intended users, the service providers, to revisit the service plan on at least a yearly basis. And this is to ensure that the services they are providing align with what they put in their service plan. And if things have changed, to maybe amend the service plan. And this should definitely be a process that tenants are involved in. And tenants are also users of this service plan because they can better understand what is expected and promised of the service provider for the services that occur in the building. Next slide, please, Maya. Great. So this is an example of what the template looks like. Earlier, I went through what the philosophy, what the supportive housing philosophy was. And these are the examples of those guiding questions in the template. The template is a fillable PDF. This is the first page of it. So the basic information around project name, owner, service provider. And then this is the fillable PDF. You can put in your mission statement, vision statement, program values. It's important to have conversations with property management about what their philosophy is. And while filling out this template, you can, service providers and property managers might need to have a conversation about how their philosophy and values and visions align or don't align, and what that's going to mean for the operations in the building. It is important for philosophy for everyone in the community to understand housing first, and how the project will practice housing first to fidelity. This is an example of just one of the guiding questions that occur in the template. And once these guiding questions are filled out, you'll really have the bulk of your supportive services plan created. And great. And next slide, please, Maya. Great. So this is the guidebook overview. So this is where the best practices, this explains. So in addition to just defining what Housing First is, we included what the principles look like of Housing First. We describe what the importance of including that information in the guidebook is. And it's a way for the user to quickly reference back what that section should really look like. And next slide, please, Maya. Great. Throughout the guidebook, we use quite a few different key terms, and those are all defined for easy reference throughout the document. Assertive community treatment and critical time intervention are both supportive housing service models. Housing First, we've defined. Harm reduction is a strategy used within supportive housing. Intensive case management is another supportive housing service model that we frequently see in supportive housing. The memorandum of understanding is a document between either the service provider, developer, sometimes also property manager. That really dictates and codifies roles, responsibilities, financial agreements, termination of the agreement or the relationship. Notice of funding availability. This is important to include or define in the service plan, because this is where a lot of the regulations for your supportive housing might be dictated especially around outcome reporting, program design, program overview. Person-centered, all supportive housing should be person-centered. That is placing the tenant at the center of the service delivery. In any sort of service delivery, a strengths-based approach is really important. Tenancy support services is the fourth service model that we define in the staffing and services provided section. Transitional age youth is or TAY is a certain population that is oftentimes supported in supportive housing. And then trauma-informed care we defined as a way to provide services to the people in the tenancy that is very common, that is necessary in the community. Next slide,
Awesome.
please. Thanks, Maya.
Yeah, thank you, Alyssa. And so, like Alyssa mentioned, we wanted to pull out a couple of these sections and do a little bit of a deeper dive on what they mean kind of holistically, and then how they present themselves in both the guidebook and the template. So we pulled out the tenant involvement section and want to draw your attention to a couple key facets of what tenant involvement really means and what tenant involvement can look like. So when we're talking about tenant involvement, we're really talking about meaningful, authentic, and transparent partnership. I think oftentimes when we're thinking about tenant involvement, we might not think of the word partnership. We might incorporate feedback or solicit feedback, but we're not really engaging tenants in a way that is a partnership. And so in this guidebook, I think that we put forth a really good argument for why partnership should be used and should be built toward. We also differentiate between this idea of incorporating feedback and co-designing. And so this template and this guidebook and ultimately an organization service plan really has the opportunity to move or pivot to this kind of co-design model. And co-designing is rooted in partnership, it's rooted in that authentic, meaningful, and transparent relationship with tenants. And it goes a bit deeper than just soliciting or incorporating feedback, maybe into the plan, maybe into the operations, maybe into policies or procedures. I want to highlight that the feedback loop or the accountability loop is really critical when we're soliciting any kind of interaction, engagement, partnership with tenants, there might be opportunities for tenant suggestions to be implemented for maybe a policy change or a change in the physical building, a change in operations. And so when there is that kind of ability, we do want to, after we've partnered, had conversations, collaborated with tenants, follow back up with tenants on what exactly is going to happen from those conversations or from that collaboration. Likewise, there are also going to be times where maybe there are tenant suggestions for policy changes or physical changes that just aren't implementable, maybe not at that time, or maybe not within the lifespan of the supportive housing program. And it is really critical that if suggestions are not able to be implemented, that we also circle back. We also follow up with those tenants who might have made those suggestions to let them know, hey, this isn't possible at this time, and this is why. We really want to keep that transparency in the relationship that we build with tenants. Tenant involvement can look a variety of ways. Tenant involvement can look like holding focus groups, informational interviews, like Alyssa, myself, and Christina, another national consulting team member, did to get feedback on these materials we're presenting here today. Tenant involvement can look like tenant advisory councils or boards, can also look like tenants as employees. So oftentimes in supportive housing, it is common to have tenants or folks with lived experience or expertise as on-staff employees. Tenants could, serve a variety of roles. Tenants can also serve that peer support worker role. And lastly, tenant involvement really promotes housing satisfaction, right? Because when you are heard, when you have that kind of meaningful partnership or relationship, it promotes that kind of satisfaction within the supportive housing program. So I want to draw your attention to what the tenant involvement section actually looks like in the guidebook and in the template. So here we're looking at a screenshot from the guidebook, and we really do call out that tenants are the experts in understanding what quality supportive housing looks like, because tenants are living in that supportive housing. And so tenant voice should be elevated, should be heard, and should be implemented at all times possible. Like Alyssa mentioned, quality supportive housing programs do engage tenants throughout each phase of developing, operating, and improving supportive housing. And we do want that partnership and that relationship to be meaningful. There are a few examples, which I covered on the last slide, of what tenant involvement and engagement can look like. But we do want to emphasize that in whatever ways that tenants are comfortable and are willing to be engaged and to be involved, that's the right method to involve and engage them. We don't want to create a focus group where folks are not really willing to participate in that focus group. Maybe folks would rather form an advisory council. Maybe folks would rather do anonymous surveys. So we want to be flexible in how we implement tenant involvement. We also have a resource directly in the guidebook. It's linked. It's the Department of Housing and Community Development's Home Key Client Engagement Toolkit, which goes a little bit deeper into how to engage tenants in supportive housing. And here is a screenshot of the template, the tenant involvement section in the template, with a series of guiding questions that are informed by the guidebook. And the couple of questions we have here are: how will tenants be authentically engaged in the program's policies, protocols, and operations? We ask about accountability. So what does accountability to tenants look like for both property management staff as well as service provider staff? We ask, how will the supportive housing program encourage the formation and structure of a tenant advisory board, committee, council, or some other form of group? And we also ask about skill building opportunities that might be available to tenants on site or within the community. And we know that tenant skill building opportunities, opportunities on site or in the community can really promote housing stability. Tenancy is a skill in itself, right? And the day-to-day things that tenants are doing to maintain their tenancy are a series of skills. So we do want to, as much as possible on site or through relationships in the community, provide tenants with tenant-sustaining skill building. And Alyssa, I'll pass it back to you.
Thanks, Maya. Great. So Maya went through the guidebook and template for tenant involvement. Another thing we talked about that this guidebook has is best practices. So in the outcomes section, in addition to an overview of why it's important, where outcomes can be found, and how to track outcomes, we also provide some best practices around outcome measures that we see across the country. So these are very broad, and the quantified goal right here is nationally what we see. It is very important for when you're creating a service plan to refer back to what is required by your funders, what is required by your partners, and what you are currently doing if you are currently providing services. If you are providing services and you have a track record of housing retention that is above 85%, which is the first outcome listed on this listed here, you probably don't want to start at 85%. Your goal should be either what you're currently seeing or a little bit more, because it is a goal. So this chart really shows some of that best practices that we've included in this manual for this in this guidebook for you to reference when creating a service plan. We have metrics for service providers. We also have some metrics for property managers as well. And it is important when creating a service plan and working with your property manager to understand what types of things they look for to define quality and how they define quality. I'm going to talk a little bit about a couple of these metrics. So housing retention, which is the first one, is extremely important. Nationally, we see around in supportive housing, around 85% of tenants are either housed 12 months or have exited to another permanent housing situation. 75% of tenants who exit permanent housing, or the percentage of tenants who exit to permanent housing after leaving supportive housing is about 75%. We also understand that it's important to track any sort of mental health improvements. This is an important one, and it is self-reported by the tenant. So this is where outcomes really tie into tenant involvement and tenant input in their service plan. Another metric is there's a couple metrics around mental health challenges and behavioral health challenges and connecting them to care in the community. We also use different or encourage different, like Maya said, different types of surveys to better understand what the outcomes what the outcomes of the tenants are. We can see that in the percentage of tenants who report they're satisfied with their housing or they're satisfied with the location and safety of their housing. It is also important to understand the number of tenants, that are using services. Supportive housing, it's not required for tenants to use services, but it is, I like to say, it is required for the service provider to try to engage tenants to use those services provided. Great. Next slide, please, Maya. All right. So the final section of the guidebook is the attachment. So we know that the service plan is a core document that really guides quality supportive housing in a supportive housing program. It's oftentimes required by funders. It helps It helps establish how you're going to execute those services in your communities. But we also know it's a document that references other documents and is not the only document that is required for funders or when creating a supportive housing program. So we have a list of attachments here for different that provide guidance to different on different types of plans or different types of tools that could assist the user in completing the plan. The first one I'm going to talk about is a supportive housing property management plan. This is different than the service plan, but it's a document created by CSH. It is formatted similar to the service plan, but it has the different components of what a property management plan should include. It has a template, so it has those guiding questions around property management, and then best practices on property management. We know a core component of supportive housing is that communication between the service and the property management plan. So as much communication and coordination that can occur while developing these two plans creates for a better quality program. It's also helpful to share these two plans between the property manager and the service providers, because it helps define the roles and the responsibilities and gives each entity a better understanding of the approach that each service provider or property manager is going to take. The next attachment we have in the plan is a tenant selection plan best practices. So what we have here is we have some best practice guidance around creating a tenant selection plan. We really like to see tenants screened into housing instead of screened in. There's 3 documents there. Another one, and the other document really describes some common myths when creating tenant selection plans around the requirement of background checks, the requirement of arrest records, things around that. And then the next one, we talked a lot about MOUs and the importance of using them to really establish the different roles and responsibilities of a service provider and property manager and owner. And in this attachment, we outline some of the most important elements of an MOU if you are going to create an MOU between some project partners. The next one is the supportive housing budget tool. This is a tool that CSH created that allows users to input some of their assumptions about what their supportive housing budget will look like, and then it spits back to you based on national cost averages and your inputs, how much running a program like you detailed in your supportive service plan would cost. I'm going to talk about that one a little bit more in a second. And the final one is the supportive service planning worksheet. This is a fillable PDF that allows users to understand and document what services will be provided to their tenants and whether or not they're providing them, or if they have a relationship with a community provider, or if another service in the community is available. So I'm going to talk through those both a little bit more. Next slide, please, Maya. So this is the supportive service budget tool. It comes with its own user guide. It comes with some academic literature on the different service models in supportive housing that are outlined in our guidebook. So the ACT, intensive case management, tenant support services, and critical time intervention. This service budget tool also allows you to pick the housing model, whether or not it's a development, site-based, or a scattered site. It allows you to outline some of your startup costs if it's a new one. And then it will allow you to document any revenue structures or reimbursement restrictions. So the green tabs will give you, based on what you put in on costs and national averages, will tell you about how much your service program will cost. Next slide, please, Maya. And just on that, it is there's the guidebook, which is a PDF, and there it is an Excel worksheet, which can be found on our website. The next attachment that I'm going to talk about is the supportive service planning worksheet. When the guidebook includes an overall information on supportive services, different models of services, but it doesn't go into too much detail on the different services that are available to tenants in the community. This attachment is a 4-page document that really lists pretty large list of services available. And then it allows the service provider to document who will be providing the services and where and how the tenants will access the services. This first page right here, the general support services, a lot of them will be provided by the service provider, but some of them will require different, maybe community referrals. This goes through many different general supportive services, employment services. It outlines community-based services, like if there is food banks, or educational support, childcare services. So it's a pretty exhaustive list of services that many communities provide, and how to link different tenants to those services. Great. Next slide. How should this be used? So we talked, so far we've talked a lot about what this tool is, and how to functionally use it. But now we want to talk a little bit about the practical application and how it should be used. So the first one is funding applications. We know many funders are very interested in what services will be available and how they will be available to tenants in supportive housing. So funding applications, many require the service provider to submit a service plan, along with some of the other plans we talked about, a property management, a tenant selection plan, those type of things. So this is very important for the funders to see and evaluate to ensure that supportive housing will be quality and will be quality supportive housing that the tenants receive. We also recommend that the service plan should be revisited at least annually, and also requiring staff to reread it and become refamiliarized with what was included in the service plan. It is so easy for direct service staff to get bogged down and overwhelmed in their day-to-day, because what they are doing is so important. But it's important to remind people that this is why you're doing it, and this is how how the organization said they were going to do it. The next way this should be used is using this as an outline to solicit feedback from direct care staff and tenants. We're always looking to improve, so using this as a document to get input from the people that are in the community and the tenants that are using the service is also really important. And then the final one that we have listed here is quality standards and improvement. We talked a little bit about outcomes, as your program enters year 2, 3, or 4, you can really use this plan to document your quality measures, your standards, your improvements, track your any increases in the goals or decreases in goals. So it's really a great way to implement quality services and quality supportive housing for the tenants. I am gonna pause there and see if any of the other presenters want to say anything before we transition into our question and answer section. Great. I guess Maya, next slide. So we've come to the end of the formal presentation part of this webinar. We really invite you to raise your hand and we'll take you off mute or type a question in the chat if you have any questions around the guidebook or the template.
I will quickly just say, I know we've received a lot of inquiries about how to access the template, how to access the guidebook. So all attendees here, because you registered and we've been able to log your emails, will receive a copy of the Supportive Housing Service Plan template and guidebook really quickly after this webinar.
Great. So I see we have a question in the chat. I think that the first question Nicole's answering by typing in the answer. And the second question is, how have people typically gone about securing their housing stock for these programs? There are many different ways to secure housing stock for these programs. Having supportive housing, developing new single site supportive housing is a way to do this. And that is when a developer, supportive service provider, and a property manager partner apply for different fundings. HCD being one of the larger funders in California. And then they develop or build supportive housing stock. And there are supportive housing can also be created in scattered site, different scattered site models. So that is where tenants receive a voucher and services, but they can use that voucher in the open market to find housing.
Perfect. I'm seeing a couple more. Could you describe a tenant council? How often do they meet? Who runs it? So yeah, nationally, it has become a much more popular way to engage tenants is forming that kind of governing body, council, advisory board. There are many names, but it is run by tenants, for tenants, and is used to kind of collect tenant feedback, have open discussions about different ideas, and then present them to property management, service provider, owner, whoever the applicable party might be. So it is a tenant-run council that is backed by the support of all of the staff who are running the supportive housing program. How often they meet can definitely vary. You know, when a supportive housing program is just coming online, tenant councils might want to meet more frequently, maybe twice a month, once a month. Tenant councils can also meet as infrequently as maybe once a quarter, right? I think tenant councils can also kind of meet ad hoc if there is a new idea or a new policy change, or something kind of floating around that tenants want to have a say in, and maybe propose something to property management or service providers. And so it's not a clear-cut answer. It definitely can look a variety of ways.
The next question on there, are there other ways to incorporate fair housing other than advocating for reasonable accommodations? Our fair housing section does go into a little bit more detail than just reasonable accommodations. There's also reasonable modifications if there needs to be any renovations or changes to the physical environment in the building. We also talk a little bit about service providers assisting tenants finding free or cheaper legal services if they believe there is a fair housing violation. And then also something not included in the guidebook, but fair housing trainings are common for supportive service staff members that go into, and property managers that go into a lot more detail around fair housing issues that tenants might face.
Quickly, there was a question in the chat that I just wanted to circle back to from Amanda, talking about if they're going after their first NOFA grant application. Am I understanding correctly that if we fill out this tool, that'll be a large part of applying for the grant? Typically, I think that utilizing the template and guidebook will kind of get you to the answers to the questions that will be presented in a lot of NOFAs. So it might not be one for one exactly what they are asking for question by question, but the bulk of it will likely overlap. There's an anonymous question: are organizations guidebooks that used your model available to view? I'm not sure if I have a totally clear understanding of that question. We did utilize a couple of internal resources here at CSH to create these materials. And so those guidebooks or service plans we would not be able to share, but please let me know if I am misunderstanding that question.
I would also like to bring in maybe a member from the California Housing Community Development Team. I believe some of the questions are a little bit more structured than what we would be able to help offer as a response. And so just looking if we could get some assistance, or if we could just do a follow-up maybe after the call on some of the questions. One question that's coming in from Mary Brown is in regards to the question of seeking service providers for supportive projects developments across the state. So just looking at the reach across the reach across all of California. We'll like kind of just some insight from the California team on your thoughts there. And then I'll hold for the other question that I believe is centered around authoritative resources.
Sure. Sorry, can you read that question one more time?
Sure thing. The request is coming in from Mary Brown. We are seeking service providers for supportive projects development across the state. So I think it's more of an ask. I just don't know if there's one main resource that the Housing and Community Development Team may have for a list of service providers that can help offer services across the state of California at the footprint. So I just wanted to lift that up for your insight.
Sure. Well, we really rely on local communities to be able to target their needs and understand the community and population they're serving. So hopefully there is resources there. We do suggest connecting to the homelessness response system And so the continuum of care would be a good resource to see what providers are connected to them, as well as there sometimes being able to connect to other peers within your area or other providers or communities nearby that can also make recommendations on who they're working with and how they're supporting these types of services.
Thanks, Nina. The second one that's being lifted up, this one is again coming from an attendee on the call today. Is this now, and assuming that means the guidebook or the template, is this now the authoritative resource that HCD has adapted from CSH for supportive housing, or is this just one of many guidelines / helpful tools?
It will definitely be a key resource for any supportive services plans that are connected to our grants. So I'm assuming that's kind of the line of will it go for all programs at all times? No, all of our programs do continue to evolve, and each program will have, every year's new fund, things like that. However, it does highlight a lot of guidance and best practices that we've worked with CSH to we think really do highlight the best type of quality services that can be utilized in these spaces. So it does. This is really sort of a one-stop shop, a little bit of not needing to go to a lot of different websites to find some best practices. They're here in this guide. However, more best practices are always highlighted. HUD has them. California Interagency Council highlights new ones. HCD ourselves will continue to share out more resources. So, but this is a great starting point. And we do hope it's helpful as you're filling out your supportive services plans that are connected to our programs.
And I got one more for you, Nina. This one is coming from Nicole Matcham, asking if we have to be supportive service certified, and if so, what is that process, please?
It will be unique, I believe, to the programs. I don't know that off the top of my head. I apologize. But when our programs do request them, we have teams within HCD that review and are able to provide technical assistance on what those service plans require.
Thank you so much. I think that was the last open question that we had. Wanted to again open up the floor for others that are still with us today. Are there other questions that you'd like to put in the chat for us to help offer insight to?
I just threw, there's a couple questions in the chat asking for resources. I just threw in a guide to creating tenant councils. It's a guide that CSH created. And then someone asked about HUD trainings for fair housing. I did not put the right link in there, I'm seeing now. Let me put that in right now, but they have a National Fair Housing Training Academy that I will link you to now. Sorry about that. Here's that correct link.
And then there was another participant that put in the overall group chat that came from Kendra Robinson, that they provide supportive services. So they have interest. If you would like to reach out, she put an email contact information in her chat response. So that could be an additional opportunity there, those interested. It's often awkward to just leave leave space with silence. And so while you may not see my voice, I won't make it as awkward. I'll put my face on the screen as well with you. But I just, again, I'm always open and graceful in regards to capacity and needs of others and doing this great work. And so I don't want to shortchange our session today without leaving more space for additional questions. CSH, we're only an email away if there's other inquiries or interests that you may have. I know the California team as well. They're very committed to lifting up the opportunity for developing and building quality, supportive, and affordable housing units. The partners on the HCD team that are with us today, they are also open to further discuss with you questions that you may have about your up and coming projects or future funding opportunities. And so I just want to defer again to ways that you can stay in contact with this team, this group, and direct more guided questions, maybe specific for your project, by reaching out using that account or email address reference there. And then again, I will turn it back over to Alyssa, Maya, and Nina to help close us out. I appreciate everybody's engagement today and feedback and interesting questions. We appreciate them all, so keep them coming.
All right. I'm not seeing any new questions in the chat. We have left some space. We are happy to hang on if any do come through, but otherwise, we definitely appreciate your time today, all of the questions, all of the thoughtfulness. And I know our team and HCD's team's been really excited to get to this point. So thank you for spending your afternoon or maybe your morning with us, and we hope you have a great rest of your day.